How does parasympathetic innervation affect the heart? A. Increases heart rate and decreases cardiac output. B. Slows heart rate and increases cardiac output. C. Slows heart rate and decreases cardiac output. D. Increases heart rate and increases cardiac output. The answer is C. Slows heart rate and decreases cardiac output. Sympathetic innervation will decrease the heart rate, which will automatically decrease the cardiac output equals stroke volume multiplied by heart rate. Which of the following causes the S1 heart sound, lub? A. The opening of the aortic and pulmonary valves. B. The closing of the tricuspid and mitral, atrioventricular, valves. C. The closing of the aortic and pulmonary valves. D. The opening of the tricuspid and mitral, atrioventricular, valves. The answer is B. The closing of the tricuspid and mitral, atrioventricular, valves. The S1 heart sound, sometimes referred to as lub, is caused by the sudden snapping shut of the tricuspid and mitral valves during systole, when the heart contracts and tension on the chordae tendineae is released. No sound is produced on the opening of these or any other valves in the heart. The contraction rate is set in what area of the heart? A. The bundle of His. B. The atrioventricular node. C. The synovial node. D. The Purkinje fibers. The answer is C. The sinoatrial node. The contraction rate for the heart is set by the cells of the sinoatrial node, also known as the pacemaker cells of the heart. These cells have membranes that are especially permeable to ions, and are able to depolarize on their own at a rate of 70 to 100 beats per minute. All the other areas listed do have their own spontaneous contractility, but their rates are slower than that of the sinoatrial node. Thus, the sinoatrial node is the pacemaker in a healthy heart. Which of the following is the proper unit of measurement for blood pressure? A. Millimeter of mercury. B. Gram per deciliter. C. IU. D. Deciliter per millimeter. The answer is A. Millimeter of mercury. The proper unit when recording a patient's blood pressure is millimeter of mercury, or millimeter of mercury. This is derived from a historical measurement of how many millimeters of mercury in a mercury manometer were able to be elevated by a particular pressure. Due to its toxicity, mercury is no longer used in medical equipment, though the millimeter of mercury unit remains in use. A patient has a 49-year history of hypertension. Which part of the heart would be most enlarged on echocardiogram? A. Right atrium. B. Left atrium. C. Left ventricle. D. Right ventricle. E. Pulmonary artery. The answer is C. Left ventricle. The left ventricle is the most commonly enlarged heart structure seen in chronic hypertension. The left ventricle must overcome the afterload of the arterial system by becoming hypertrophied. As a result, the heart gets remodeled to overcome the systemic high blood pressures. The left ventricle directly pumps blood from the heart to the systemic circuit.